Hi and welcome to this afternoon's webinar where we will be looking and exploring the myths, misconceptions and musings that we find out of questions we're commonly asked as support coordinators of those that are diagnosed with the various types of blood cancers. My name's Kathryn Huntley and I'm one of the support services coordinators here at the Leukaemia Foundation of Queensland. Previously to joining the foundation 8.5 years ago, I worked for around 8 years as a nurse, the majority of that time spent working in oncology and haematology and also in transplant wards over in London. So today's webinar, we will be exploring, as I mentioned, the frequently asked questions that we as support service coordinators get asked from time to time by our patients and their families. And these questions come from people with all various types of blood cancers that we support, including leukemia, lymphoma, myeloma, amyloidosis, myeloproliferative neoplasms, MDS, aplastic anemia, and some other related blood disorders. If you'd like to specifically ask a question, and if we have time at the end, if you type it in the question box, we'll be able to see your question and hopefully address this for you. We will also be covering questions that look at things related to diet, exercise, hygiene, relationships, and more of just day-to-day questions that arise. So before we start, I would like to remind you that you should always seek advice from your treatment team before you go about making lifestyle changes to your diet or trying a new exercise or adopting a new lifestyle. You should discuss this with them to make sure it's not going to be contradictory to your current treatment plan. As I mentioned, these questions have come from our experience and we hope that these questions may answer some of the ones that you have as well. They may not also be applicable to all of you, but I hope by the end of today you get something out of this session. Now, as I mentioned, the big take-home message is that you should always ask your doctor these questions if they specifically relate to you. These questions today will be answered in quite general terms. So a question we're commonly asked is whether someone can exercise. The answer to this is definitely yes. Exercise before, during and after treatment have had and shown many, many benefits. We here at the Leukaemia Foundation have started a pilot program this year called Fit to Thrive, which in relation to Aspire, which is a rehabilitation centre with exercise physiologists, run a 12-week program for people newly diagnosed and those before stem cell transplants, creating a 12-week program of exercise to help with recovery and maintaining optimum health. We have found that people have had an improvement in their quality of life measures by doing this, and I think I'd like to hand over the quotes that we've received from people to explain how beneficial their experience with Fit to Thrive has been. So feedback we've received has told us that the program has given them the opportunity to get their sick and tired body to work again, that it was excellent, what they needed to help them live again, that the staff at LFQ were generally interested in their progress. The phone calls were extra motivation to get to every class. So we have 2 staff here who have been supporting the patients on this program and making sure and keeping in and sending motivational emails on a fortnightly basis. I was sore in the beginning. As time went by, things got easy and I felt hard. And I felt I had more energy, sorry. As you can see, the benefits for people overall seem to be quite beneficial. Unfortunately, at the moment, the Fit to Thrive program is only run in Brisbane, but we're exploring how we can roll this out further throughout Queensland. But if it's something that you'd like to explore now using exercise as a part of your recovery, you could consider the Medicare care plans, whereby you go see your GP and discuss this with them, and you're entitled up to 5 visits with a health professional. So this would be with an exercise physiologist that could prescribe a exercise plan for you that you may be able to undertake in your local gym or even within your own home, and that's covered by Medicare, and as I mentioned, there's up to 5 visits per calendar year. And it's always important to remember when you are exercising that you should always listen to your body. should I eat organic? We here like to endorse that you should focus really on a balanced diet. By choosing to eat healthy, you are more likely to get the right amount of nutrients needed to help your body to function properly. Eating well may help you cope better with your treatment, recover more quickly from your treatment, to have more energy, to maintain your body weight, and to also fight infection by your body and your immune system. Also, having a balanced diet repairs damaged tissues affected by treatment. Eating well can improve your sense of well-being and improve your quality of life. There's a lot of misleading information available on the internet and other media regarding diet, nutrition and cancer. You should be mindful that before you make any changes to your diet, it's important to consult with your treating specialist and dietitian, as some alternate diets may interfere with your medical treatment. One of the questions or concerns that are often brought up with us, with people having treatment as well as carers trying to do the best for their patient in providing substantial meals, is the challenge of knowing what one should eat, as far as knowing what are the good foods to have, against the side effects that challenge someone's appetite and what they actually want to eat. I once had a dietitian sort of say to us, as long as the person's eating something, even if that's a bowl of hot chips, it's better than not eating anything at all. But there may be some tips that you can undertake to help counteract with the side effects of treatment that prevent you from eating a wholesome diet. So with nausea and vomiting, taking your anti-nausea medication as prescribed, and generally this is sort of about half an hour before your meals. Not to go long periods without eating, as this can make your nausea worse, having that empty stomach feeling. Eating smaller meals more often, so instead of sitting down to a big meal that will make you feel quite full afterwards and make you feel nauseated, having small scattered out meals over your day. Get some fresh air, maybe eat outside to avoid the strong smells of food. Sometimes it's the smell of food that makes someone feel nauseated. When you do feel better and you haven't eaten for a period of time, try eating maybe something like dry toast or crackers to reintroduce food to the diet. Dry, salty foods, for example things like crackers, as mentioned, and soft drinks like ginger ale are often well tolerated for someone who's feeling quite nauseated. Eat cold foods or those served at room temperature to minimise, as I said before, the smells. Limit fatty and fried foods, as they can take longer to pass through your stomach, causing you to feel more nauseated. So for some people, they get the mouth ulcers or mucositis after they have their chemotherapy, or sometimes this just presents as a sore mouth and throat. It may not actually get to the ulcer stage. But important ways to get around that and still be able to eat is to take your painkillers as prescribed, and again it would be worth taking this about half an hour before your meal so that they're on board as you eat. Keep your mouth as clean as possible, so the saline washes and that sort of thing, to try and keep the optimum skin integrity inside your mouth. If you wear dentures and they become ill-fitting, remove them once you feel like they're not fitting well, because they'll just harbour more sensitivity in your mouth. And avoid foods that can irritate your mouth while the mouth is red and sore. So foods like fruit juices, actual citrus fruits, spicy, salty foods, and alcohol, which can irritate the lining of the mouth. Choose soft, moist foods that are easy to chew and swallow if the mucositis is extreme. So ways to improve your appetite and your interest in food: it's best to eat foods that you enjoy. So I once had a story of a patient who was not eating at all, and his carer was quite frustrated because he would feel like something, and by the time she would make it for him, his appetite had moved away from that and he began to feel sick. One day his friend who he went fishing with came and bought their camp oven and cooked up the big breakfast cook-up they would normally have when they were fishing on the beach. Because of the emotion that was attached and the memories that were attached and the good feelings that were always attached to this food. He actually sat down and ate it. So food is more about just what you eat. It can also be quite a social thing. So if you make eating more about enjoyment as opposed to something you have to do, sometimes that can actually improve your appetite. Colour, they say that trying to eat more colourful fruit and vegetables or have something that's eye-pleasing can help with your appetite. If you do find aromas and smells pleasing, try to eat those foods that give up those aromas that agree with you. For some people, the smell of bread is good, whereas for others, they won't like the smell of bread. But, you know, maybe brew some coffee while you have some toast, and that can harbour the appetite. Try foods with various types of texture, and that can help with your appetite as well. If you feel that you are generally continue to struggle with the food that you're eating on a daily basis and you're starting to lose weight or you have your concerns, it's best to seek the advice of a hospital dietitian. If you're not an inpatient or your treatment's been a while ago and you're not too sure whether you can use the hospital dietitian, you could always be referred to a private dietitian, and you could speak to your haematologist or general practitioner about this. So next we're going to talk about relationships with people and who wants a hug. And there's lots of talks around when people are neutropenic and they're isolated. Every diagnosis that we deal with has a different impact on the immune system, and the immune system will be altered differently due to what sort of treatment you're having. So there's been studies done that look at the impact of looking after one's whole self, so the emotional side of things and the benefits of sharing space with people and quality of life and the impact that that has on recovery. So we sort of advocate sort of finding the balance between infection control and quality of life. So they've actually shown that hand washing remains paramount for the protection of the spread of infections. Microorganisms spread very easily, and if hands aren't adequately washed and dried, protective isolation doesn't actually change this. So hand washing is your forefront campaigner against getting an infection. So we also sort of say that by looking after your whole self, it can benefit your physical recovery. So what we're trying to sort of get an idea of here is to make sure when you're concerned about your infection, the risk of getting an infection off somebody, to think big picture and look at, you know, sharing a hug in a bed with your partner, for example, has an emotional benefit and can decrease stress, which will have an overall benefit of physical recovery as well. And to find that balance between being sensible, like when you want to go shopping, for example, and you're concerned about the crowds, maybe going shopping in the beginning of the morning as opposed when the shops aren't too busy. So trying to find that balance between living life and being sensible. So now we're going to talk about a topic that rarely gets raised and probably not spoken about as far as side effects are concerned. You know, quite often medical teams and people within the hospital will talk about the side effects that we see when it comes to nausea and constipation and fatigue, but not much is spoken about intimate relationships. So a few questions that we often get asked when they do get asked include the following. How soon can I have sex after having chemotherapy? So this varies on the treatment that you're having and how quickly you're recovering. So they say really when it comes to that you should start slowly and when you're emotionally ready. And sometimes sensual massage and touch can lead to satisfaction of intimacy. So a more physical approach can occur when you both feel ready, as long as both are ready to listen to each other and take it easy. Doesn't make any difference what position we use. There's no reason for this to be an issue. The only time that it would be a problem is if you have breathing difficulties. If fatigue is an issue and causing problems, while the act is occurring, change positions, and also use cushions and support the body parts that are sore to make sure that everybody's comfortable. Do we need to use a condom? You do need to use a condom immediately after and for 48 hours after chemo. They recommend that you do not try to fall pregnant or father a baby until being cleared by your treating doctor, so this shouldn't occur while you're having active treatment. Is it normal to lose interest? This is probably one of the questions we do get asked quite commonly, and unfortunately one of the consequences of fatigue and anaemia is a lack of sex drive in males, some of whom will also have difficulty in achieving an erection. Although this can be an embarrassing topic to discuss either with your partner or with a healthcare worker, there is plenty of advice available that will help you in this situation. So the moral of that is to ask. Women can also lose their sex drive during treatment. Again, there's lots of information and advice available from specialists, books, and there's also information on the internet. So sometimes this means while treatment's going on, the sex life and intimacy will not be the same as it was before diagnosis. So it may be a matter of coming together as a couple and redefining intimacy. So as mentioned earlier, the simple touching the person that you love can give a powerful sense of acceptance and warmth, and a sense that you're sharing the journey with them. So quite often we get asked about the family pet. The furry members of the family can assist with what we mentioned earlier about the emotional health and in turn the physical recovery. So we suggest here that you take sensible precautions when it comes to caring for your pet. So making sure that you're washing your hands post playing with your pet or patting them, to ensure that if they by any chance have anything, as we mentioned earlier, that hand washing is paramount in infection control. Ensuring that somebody else is changing cat litter, cleaning up after the dog, or allowing your pet to sleep with you in your bed should also be avoided. Another tip is to make sure that the pet's vaccinations and their flea treatments and worming treatments are kept up to date. Can I still enjoy the great outdoors? So as we mentioned earlier, finding a balance of what you love doing is important to looking at your overall health. So yes, you can still enjoy the great outdoors, but there's some practical things that need to be considered when enjoying those outdoors. So first of all is sun protection. So whilst having treatment and afterwards, especially when there's been hair loss, should be heightened sun safe practices. Some of the treatments that some of our patients have actually makes them at higher risk for skin cancers. So not only should they be practicing safe covering up and sunscreen, they should also be getting their skin checked regularly. A lot of our patients discuss gardening and whether they can still do that with us. Again, it's about being sensible and check specifically with your doctor, because sometimes people have got a history in gardening, some side effects of treatment which may enable them not to garden. But by taking precautions like wearing gloves and also a mask when dealing with soil and potting mix can mean that you can continue your gardening hobby. Making sure that you are very mindful of avoiding scratches and cuts from branches and when pruning, and also probably avoiding this when your counts are neutropenic. Fishing, just to remember that the bait is sort of raw meat, and the tackle that you use will also be contaminated with this bait, so important again to wear gloves and to wash your hands, and if possible to get somebody else to bait your line for you would also be ideal. Just things to generally be aware of when you're outside and enjoying the great outdoors: to make sure you dress warmly in winter, and on hot days to make sure that you keep hydrated. It's important to remember if being outdoors is something that you enjoyed before being diagnosed, you should endeavour to enjoy it again, because it can be very uplifting and it may also be a part of who you are. So with adequate protection, enjoying the outdoors can still be enjoyed. Can the kids still stay in daycare? So we get asked this question not only when the child is a patient, but when the sibling's patient or the patient themselves have children. So when it's the child who's a patient, we advise that you speak with your treating doctor. Often children will still attend school when their counts aren't low. Treatment for children occurs over a long period of time, and continual discussions with your treating team over when school attendance is appropriate should be discussed ongoingly, but there are benefits for the child attending school and having normality within their life. When it does come to sort of all children, whether they be a patient, a sibling or a child of a patient, discussing often with the childcare centre staff or the school teachers the extra care needs that they need and vigilance with infections. So often what will happen is that if they have a child that comes to the centre who has vomiting or some sort of infection, they will actually call the parents of our patients to let them know so that you can make the choice of whether to keep the children in care or remove them to decrease the chance of them getting the infection at the school or childcare centre. Sometimes what also gets created within the school communities as centres is awareness through those attending the schools, so all the other families as well, so that they know that if their child does get something, that they should let the centre know so they can forward this information onto our families. Another way of creating awareness within the school is the organisation Camp Quality do a puppet show which educates the families and the children within the school communities and also the childcare centres and kindergartens about what cancers is about and the challenges of that. Again, hand washing before entering and after leaving the centres can ensure that reducing the chances of infection. And as important always when we're talking about infections is that you will always report if a patient has high fevers, they need to seek medical attention. Something that grandparents often bring up for us is whether or not they should see their grandchildren, because we never quite know what children bring home from school with them. A lot of times these people are very close to their grandchildren, and sometimes it'll be the children's parents who are concerned that they don't want their child passing something on. And so what we suggest in this situation is whether you invest in some alcohol gel so that the grandchildren can use the alcohol gel in their hands before they see you. And for example, if it's flu season, that maybe it'd be best if the children return home, have a shower, change out of their school uniform, just to reduce that risk of bringing home anything extra from school. And as I mentioned previously, looking after one's emotional health is just as important to ensure the physical recovery. Can I still enjoy takeaway? So when people are neutropenic, quite often they're encouraged to follow a low pathogen diet. All foods contain some sort of bacteria, but this is generally not a problem as long as it's well prepared and well cooked, and when it is cooked that it's served hot and steaming, which reduces those harmful bacteria being within the food. So the foods to avoid when your counts are low may include things like shellfish, seafood, some vegetables, and the soft cheeses like camembert. But enjoying takeaway can occur as long as it's made ready to order on the spot and steaming hot. Some people query, obviously, when they're trying to focus on that balanced diet and looking at, wanting to have salads and getting that sort of the fruits and veggies in, look at places like Subway, for example, or Sandwich Deli. It's important to actually avoid these because the salad bars and sandwich delis and even the pie warmers, they're either kept at a mediocre temperature, as in not too cold for the salad like a fridge, and probably not ideally hot, like coming straight out of an oven. So they're best to avoid because they have the high potential of harbouring harmful bacteria. A lot of people like to prepare food for their patients when they're in hospital because they don't always like the hospital food. So enjoying leftovers is definitely something that can be done, and sometimes it's actually beneficial to have leftovers, especially when aromas are something that add to someone's nausea because they can actually eat it without smelling it being cooked for 30 minutes or so in the lead up. So just ensuring that when you do your cooking at home, that you obviously wash your hands beforehand, and when you have cooked the food, that you don't let it sit on the bench to cool, that you cover it and put it either in the fridge and freezer. And if it is within the fridge, that you heat it to steaming within 24 hours to eat, to be safe. When can I colour my hair again? So this is obviously something that we're asked as towards the end of or after treatment. So there's been no extensive medical research in this area, but the recommendations has generally been 6 months. The scalp remains quite sensitive after chemotherapy, and the new hair that does grow back is quite fragile and thin. The first colouring should definitely be done by a hair professional, and that a sensitivity test is done beforehand to ensure that they're not going to excoriate or redden the scalp or irritate the scalp. Sometimes the temporary or the semi-permanent hair dyes are a better option, and it's something you should discuss with your hairdresser. Other things to take into consideration when looking at dyeing your hair is to avoid the darker shades, as they have higher pigments and the content of that is more likely to irritate the scalp. Avoiding hair colour dyes that have ammonia in them, and for opting for hair treatment like foils which aren't directly on the scalp, which will decrease the chance of irritation. So colouring must only happen, as I mentioned, when your scalp is healthy and not dry or brittle. You may also need to be mindful of the fact that when you dye your hair, it may be a different result to what you've had previously, because your hair will be in a different condition for a period of time after your treatment. And by going to a hairdresser and having this professionally done, they'll be able to discuss ways that they can get your hair looking so that you're happy with the result. Should I get the flu vax? So this is dependent on the diagnosis and the treatment that you have. People who've had a donor transplant actually need to have all their vaccinations again. They have a completely immature immune system, like a newborn baby, so all those vaccinations that we had growing up will need to be redone, but this only happens at this point in time when the haematologist advises. Every other person who has had or has a blood cancer diagnosis should only vaccinate after discussion with their haematologist, because every vaccination is a little bit different as whether they have a live virus or not, and this is something that should only be attended at the discretion of your haematologist. So as we come to the end of today's presentation, I'd just like to remind you that if you do have further questions or you'd like to speak to one of our support service coordinators, our contact number is here. Ways that we can support you are in person, over the phone, or in the hospital. We do have a range of information and education, booklets, materials, DVDs and videos. These videos and uploads and today's webinar are available on our Leukaemia Queensland YouTube channel, where you can go for further information. We also run regular seminars and support groups, and the calendar of these can be found on our website. We run programs like the Caring for the Carer, the Grief program, and as mentioned earlier, our exercise, Fit to Thrive, and also relaxation programs. We offer financial and practice support, and if you would like to explore these, please contact us and we can discuss your needs with you. We offer accommodation for regional patients who need to relocate for treatment, and we have support officers and support service coordinators based in Brisbane, in Townsville, on the Gold Coast, and now in Cairns. So I will end today's session and hopefully talk to some of you soon. Thank you for listening in today.